Abha Sabiki, advisor and mentor to the SRL Technical Center of Excellence and also academics. It is our privilege to host this MED talk on autism awareness today. 2nd of April is the Autism Awareness Day, which is celebrated worldwide, and we are now on the 15th such annual celebration. A lot of work has been done, a lot of progress has been made regarding the awareness of autism, but we still have miles to go. And for that, we have this session where we are also going to concentrate on the importance of genetics in the diagnosis of autism. So I invite the moderator for this session, Dr. Anup Prabhu. Dr. Anup Prabhu is Associate Director, Medical Genomics at SRL Diagnostics. But before that, I would like to welcome our speakers, Dr. Kaushik Mandal and Dr. Bhavna Shinde on behalf of SRL Diagnostics. Dr. Anup, could you now proceed with the session?
Yeah, thank you, ma'am. So first of all, let me welcome everyone on this education awareness talk for autism. So first of all, thanks to the MedTalk team and SRL for organizing this event. So autism is quite common. About 1% of individuals are diagnosed with some of the clinical features that fall in category of autism or autism spectrum disorders. In US, prevalence is much higher, as high as 1 in 40 to 1 in 50. So many aspects are there: diagnosing, then knowing whether it is hereditary, what are the genetic aspect. That is, new research is happening, new information is coming in, and most importantly, the management part. So on behalf of SRL, we have organized this talk on this Autism Awareness Day. The theme for this year is inclusion in quality education for children with autism. So carrying forward last year's theme, which was inclusion at workplace, this year it is inclusion in education, right? With this, I welcome our first speaker, Dr. Kaushik Mandal sir. He is my teacher, my mentor, and he's a renowned figure in the field of medical genetics. His medical career spans almost 3 decades, and he has worked in esteemed organizations like CMC Vellore in Calcutta, and presently he is holding the post of additional professor in Department of Medical Genetics at SGPGI. So with numerous projects that he has done with ICMR, with DBT, with numerous original articles and review papers, and again, he has authored many chapters in renowned books pertaining to pediatrics and genetics. So I welcome Dr. Kaushik sir on board, and I'll request him to start with the topic, role genetics plays in autism and autism spectrum disorders. Over to Kaushik sir.
Thank you, Anup. Dr. Anup, it's a pleasure to be your teacher, and for such a nice introduction. I never knew so much good about myself also earlier. So I'll share my screen and start my talk. So genetics in autism and autism spectrum disorder. So when we type actually autism in the mesh terms of PubMed, so what we get is actually autism spectrum disorder or autistic disorder. So autism in fact spans a large group of disorders, which and also probably includes a lot of other disorders which has some similarities with autism. So this presentation is entirely targeted for awareness. The facts and figures are collated from different sources and is to be used for academic purpose only and should not be quoted without verification from authentic sources. There is no financial relationship related to this lecture. There is no conflict of interest. Autism, in fact, a small introduction to it. It has got certain very characteristic features like impaired socialization. That means the child is unable to socialize, unable to speak to, or unable to correlate to his peer group, or to parents, or to someone whom he or she should be talking to or interacting with. Then impaired verbal and non-verbal communication. So he cannot communicate his needs, either verbal or non-verbal. And there is repetitive or restrictive behavior and interest in very certain things which a person should not have for so long time. So all these things are the core features of autism. And obviously there can be some hyperactivity, cognitive impairment, depression, anxiety, and sometimes seizures and other behavioral problems as well. So sometimes autism and intellectual disability are coexisting. Sometimes we don't understand whether they are different disorders. But to be very frank, they altogether are neurodevelopmental disorders, and they span almost 1 to 3% of all population. So if you see a whole population, 1 to 3% in different age groups and different societies, there will be children or people who have intellectual disability and also autism, or autism per se, or only intellectual disability. So as I have already described autism, intellectual disability is a condition characterized by below average intellectual functioning, that is below 70% of the IQ, which is to be expected at that age. So with that, there can be limitations. So as I have shown in this figure, around 70% children with autism also show some amount of intellectual disability, and 40% people with intellectual disability also have autism. So sometimes these disorders are overlapping, but we'll try to focus and find true autism and also with autism intellectual disability, because intellectual disability per se is a very large group of disorders. So these disorders can be either isolated, that means you don't know from the face what the child has, but the child has features of autism, or the child has cognitive impairment. Or it can be syndromic, when there is a very peculiar face, very specific or typical clinical trait which is very specific to that disorder, and or growth abnormalities, like in Sotos syndrome, they have autistic features, but they are overgrowth. The children have overgrowth, they have large head. So I will show you some children of those disorders, and we'll discuss more about how we do genetic testing for autism disorder. So as this is a awareness program, and probably many non-doctors or people who are from different branches of science might be saying this, just to tell that we are formed, a human being is formed billions of cells. Each cell has a nucleus. So each nucleus, or the nucleus of a cell, has chromosomes, and chromosome contains DNA. There is also DNA in the mitochondria. We will not go in details of that. And in these chromosomes, there are around 25,000 genes packed. Many genes we know what is their function, many we do not know, and this encodes for proteins. So proteins are structural proteins, hormones, enzymes, and they are being utilized in various metabolic pathways. And this is what we want to just tell you in brief, that all our information, whether we grow or we interact, are controlled by genes. So the chromosomes look like this under microscope. So when we say a karyotype, that means we look at the chromosome. But see, this is a chromosome of Down syndrome. You can see 321. So here you can count the chromosomes, or you can see large structural defects. But when we talk about genes, we don't do a karyotype. Right? So genes are stretches of DNA which encodes for a protein. And if you stretch a chromosome, it will contain this large thread-like structure, which is called a DNA, and a part of DNA which encodes for a protein is called a gene, to be very frank. But there are other forms of genes also which encodes for various types of functioning RNA. So when we try to do a genetic test or a molecular test, we need to extract the DNA. We don't look at the chromosomes. We extract the DNA and do various types of tests. So DNA looks like this, the colorless or something which is suspended. So this is again same thing I am telling, that a karyotype looks like this, where you arrange the chromosomes. But when you do microarray, you extract the DNA, you do a molecular test, and again you try to find small deletion duplications which are not visible in naked eye. So two very important tests or diagnostic tests. One of them is cytogenetic microarray, where you can use the DNA to look at small deletions, duplications in the genome. And this is a very important test when we do evaluate a child with autism or autistic spectrum disorder. The other important technique is the exome sequencing. Sometimes there can be genome sequencing, and all these are done by NGS, that is next generation sequencing method, which is again have different platforms, and the output looks something like this, just to show you. And this is a Sanger sequencing. So Sanger also looks at the in the DNA level, but they look in small regions or targeted regions, small genes. But when you want to look for large number of genes, as I have told you, autism is genetically very, very varied. I will tell you the numbers, somewhat numbers. They are not exact numbers, and different studies quote differently. So we cannot do a Sanger for autism if you not suspect a very, very specific disorder. Like Rett syndrome is a very specific disorder which is not actually autism, but it is sometimes confused with autism. So when you see a child, a girl with Rett syndrome, you do a Sanger sequencing because it is targeted, right? It's a small gene. But for others, you do a NGS, that is next generation sequencing, and exome sequencing is a form of NGS where we see the exons of all genes, all important genes, because exons are the coding regions and they encode for protein. So we don't really look at the introns, or just we look at the exon-intron boundaries. So if you want to see the resolution, the very large gross is the karyotype, where you see large deletions, duplications, the numbers. Then for microdeletions, you can see either microarray, right? Microarray will do the whole genome for you, scan the whole genome. But for targeted, you can do FISH, MLP, or QFPCR. But if you, as I have told you, if you want to see the whole genome together for small deletion, duplications, or otherwise called copy number variations, we do a microarray. For small scale mutation, that means a substitution, base pair substitution, or one or two base pair deletion, you cannot look in by this method for all practical purpose without with some exception. We do it by Sanger if you want to do small regions, but if you want to do a large region, you do a NGS. And the various forms of NGS or the various techniques, the various methods of NGS are exome sequencing or panel testing or whole genome sequencing, as much as you want to see. Right? So rationally of clinical genetics evaluation in autism is that there is concern, because autism is genetically heterogeneous. There is a very large number of genes, very large number of chromosomal regions which are being implicated for autism. And at times it is multifactorial. That means there are gene-environment interactions, epigenetic factors, some intrauterine factors, some intrauterine infections which can lead to autism. Then the cost of evaluation is very large because if you do not so large at this stage, but it was very not a very cost effective when we were doing a few years back. The cost have drastically come down, and the information often typically will not change intervention in many such cases. It will definitely change intervention in some. So then I will tell you about the yield. Like advantages of definitive diagnosis is that the patient or the family acquires the needed services. In many countries, when a child has autism, the government gives a lot of support. Screening of associated medical risks like of morbidity, like in neurofibromatosis type 1. These children can have autism, but there are other neurological problems which can be prevented. Then there are specific recurrence risk calculation in the family, whether another child born to the same couple or the same parents will have autism. So if you do a very definitive etiological molecular diagnosis, you can tell that. Then targeted testing at at-risk family members, whether she can be a carrier, like in Fragile X. Woman, if she's a carrier, her sisters can also be carriers. So we can do targeted testing of them. Then prenatal testing, as I have told you, that if a child is fine with autism, if you have a definitive diagnosis, you can tell the recurrence risk, you can do a prenatal testing in next pregnancy. There are certain targeted therapies like in certain form of mucopolysaccharidosis, like type 2, these children might present with features of autism, but there are targeted therapies, enzyme replacement therapies for them. And last but not the least, the family is empowered by the knowledge of the underlying cause. They can choose what to do, what not to do, what therapies can be given to the child. So the known genetic causes of autism, the cytogenetically visible chromosomal anomalies, as I have told you in karyotype, is around 5%. Copy number variations, which you look at with a cytogenetic microarray, something around 10 to 20%. It is 15% per se. So in certain studies, it is slightly higher, but remember that altogether, everywhere, it is around 15%. Single gene disorders were 5%, small to start with, but with advent of NGS and exome sequencing, it has improved, and in certain conditions or in certain papers, it is up to around 30%, along with CNV analysis, that is copy number variation analysis, can also be done on the NGS data. And if you combine it together, some studies have shown the yield of around 30%. So this looks very high, and I don't recommend doing an NGS directly without doing a microarray in a child where you do not have a definitive diagnosis. Suppose you suspect a Sotos syndrome, yes, you do an NGS because it's a very large gene. NSD1 is a very large gene, and you look for and most of them are sequence variation, and you look through a NGS technique in Sotos syndrome. If there is very definitive diagnosis, you can do an NGS, but for those children where there is no definitive diagnosis, it's always good to do a microarray first and then an NGS. So the other causes are developmental syndromes of undetermined etiology, genes that increase risk of autism. There's a very large list of genes. I have deliberately not included them. There are environmental causes, that means teratogens. Many intrauterine infections like congenital rubella can have, children can have features of autism. And autism definitely is multifactorial, and there are various regions of the genome we do not know actually. Chromosomal disorders are actually this duplication of 15q11.13. This is the Prader-Willi-Angelman syndrome, and this is a very large contribution in children with autism. Around 1 to 3% children with autism will have this. So it is good to do a thorough clinical evaluation, see for features, and see if this microduplication is present. It can be done through a MLP as well. But if you do not have a few or a way to diagnose, it is always good to do a microarray pick it up. Other chromosomal disorders like Down syndrome, Turner syndrome, certain deletion, like 22q13, SHANK3 deletion, they present with autism, and sometimes they are having certain features, and but at times they can have been missed just by looking at the child. Single gene disorders with autism are Fragile X syndrome. I will tell you about Fragile X. PTEN macrocephaly syndrome. PTEN is a disorder which causes is a gene which causes tumors. Sotos syndrome is a disorder, a single gene disorder where there is large head and overgrowth to start with. The adult head is near normal. Rett syndrome actually is not autism and should not be included, but the features are so similar that some authors or some people include it as autistic spectrum disorder. Tuberous sclerosis can present with autism. Tuberous sclerosis, you know, that is a single gene disorder. At least 2 genes are known for that, and they present with skin manifestations and intracranial tumors. They can present with seizures. They can also present with autism. NF1 or neurofibrous type 1, Tuberous, certain metabolic conditions, and there are many other single gene disorders with significant dysmorphology which can have syndromic autism. So Fragile X looks like this. So 1 to 3% of children with autism can have Fragile X, and more than 50% of children with Fragile X have features of autism. The characteristic features are long face, and there are certain other things like macroorchitism, downturned dysmorphic ears, large ears. So sometimes you can appreciate, sometimes you cannot, but it is always good to do a Fragile X testing in children with autism or intellectual diseases. So children look like this. You can see a long face, and it's a triplet repeat disorder. You don't find it in karyotype, you don't find it in microarray, you don't find it in NGS. So it is very important to suspect this disorder or do a fragile X testing blanketly in all children with autism. The second is PTEN macrocephaly syndrome. Sometimes they have slight macrocephaly and these children may present with autism. Again, this can be picked up by NGS-based technique. Sotos syndrome, I have told you, they have overgrowth, they have large head. They might have congenital cardiac defects and the gene is NSD1. There are one or two more genes, but this is a large gene and again mutation is through NGS. Tuberous have very typical features. You can see the skin. This is a hypopigmented patch. Then you can have PT troubles with them. So these are facial angiomas, right? These are hypomelanotic macules. They can have saccharine patch. Inside the brain in CT, you can see very classical tubers or which can cause seizure. And the two genes that I have told you, CSP1 and 2. So again, we do not know the features are same. So again, NGS-based method. So if you see this very typical features, it is always good to do NGS to start with. Rett syndrome is MECP2 gene. As I have told you, they have very typical features. They have a normalcy of development at around 6 months. Then they start having certain regression. They have a midline hand activity, repetitive activity, stereotypic hand movement. This is an X-linked dominant disorder, and females are only affected with this disorder. There is gradual loss of language. These children look like autism, but this is Rett syndrome, and if you diagnose Rett syndrome, it is always good to do a Sanger sequencing for MECP2 gene first before going through NGS for other disorders. So this is the typical features or figures, like around 15 to 20% girls with MECP2 Rett syndrome and early diagnosis of autism. MECP2 mutation is found in 1% of children with autism, or mutation testing by PCR and Sanger sequencing. So Sanger sequencing is that we MECP2 has 3 exons and we amplify exon by exon and look from one side to another, and then we match with the reference sequence to find out whether this girl has Rett syndrome or not. Other disorders, metabolic disorders are phenylketonuria, certain mitochondrial disorders, adenyl succinate lyase deficiency, creatinine deficiency syndrome, Smith-Lemli-Opitz syndrome. They all can present with autism, but some of them, like Smith-Lemli-Opitz, has very specific clinical features and you can suspect it. Other single gene disorders like Cohen, see, this is a child with Cornelia de Lange. This is a baby, but when they grow up, they are small children. They have very typical facial features or which can be picked up. They have limb anomalies, but these children have autism. So in suspect Cornelia de Lange, again, it's a single gene disorder. Angelman, William, they are microdeletion syndromes who can present with autism. So the counseling issues for autism of unknown cause, when you do not have a very specific syndrome or a clue to diagnosis, is that it can be multifactorial. In many cases, risk of siblings, that is empiric risk, is 5 to 10% for autism, 10 to 15% for milder symptoms of autism. For families with 2 or more affected children, the recurrence is 35%. So we tell that if one child is affected, the empiric risk of recurrence in the next child is around 7%. Yes, and if 2 are affected, the risk of recurrence is around 14%. So it increases with more children with autism. Sisters of proband has 1% risk for milder features of unknown autism or autistic disorder. So take home message that there is a strong genetic basis of autism, and you can see that various molecular tests have a yield of around 30%, if not more, in various series. Definitive etiological diagnosis is possible in a significant group. Definitive diagnosis has been proper genetic counseling, which is not only the therapeutic aspect, but also the career risk, the risk of recurrence in the family. A careful evaluation is required in each individual to find a cause, because we offer prenatal testing for various disorders, though we have really given prenatal testing for autism, unlike various other disorders or intellectual disability, when we have only found the cause. So looking at the cause in the child, the affected child, is very, very important. because without doing a molecular testing, you cannot do a prenatal testing. You cannot predict the risk, and you know that prenatal testing is risky. This is a serious. The risk is low, but still it is risky. We do not do a invasive test without a very definitive diagnosis or molecular test in the other child, which matches with the phenotype. And this is amniocentesis. We take out amniotic fluid and we can see the same genetic defect in the next pregnancy. So thank you so much. The organizers, Dr. Anup, who has invited me, the funding agencies who has given me opportunity to do research on various disorders, my patients who have given me opportunity to learn, my colleagues in the department who work with me, and my group of bikers. So I do serious biking. In fact, today morning also I did some biking. I came in the correct time to meet this deadline. And it's a group work. So to tell you, it's a group work, right? We do biking, it's a group work. Similarly, to treat children or for management of children, it's not geneticists, it's not pediatricians. It's a group work. There are therapists, there are development pediatric people. So it's a group work. And my next speaker will tell you about this group work. So thank you so much. Thanks for being with me.
Yeah, thank you, sir. Thank you for such a wonderful speech. Indeed, for autism, understanding the role of genetics for common people, it is very difficult. And you simplified the topic so much. And just to point out, like for a family, when a genetic diagnosis is known for a child who is affected, things become a lot easier. Management and taking care of the child is one aspect, but more important aspect is understanding the exact risk of recurrence. And in those cases where molecular genetic diagnosis is made in the affected child, we can provide services like prenatal diagnosis, so that we can see that next child born doesn't have the same molecular genetic abnormality that was there in the previous child. That can be checked by prenatal testing. So thank you, sir. And it's good to see your biker team excursions taking place. We'll love to join in sometime. Thank you, sir. So with this, we move on to the next topic for today. That is management of children with autism. So we have our next guest speaker, Dr. Bhavna Shinde. She has been a friend, a colleague, and a mentor as well. She is a pharmacologist by profession. She is expert in infectious disease pharmacotherapy, particularly HIV. She's been working with multinational corporate drug companies like Pfizer, Cipla, and so on. And along with that, she has been a crusader for the children or the group with autism. So I think for today's occasion, there is no better speaker to justify this topic of management of autism than her, who has seen this particular condition from various perspectives and both sides. I think she'll be able to elaborate it better. So with this, I invite Dr. Bhavna Shinde to please take it ahead. Thank you.
So, Dr. Bhavna, shall I share the presentation?
Yes, please. To put it into the perspective, what Dr. Anup has mentioned at the beginning, 1% is 1 in 100. We have 1.4 billion population. Just making calculations will help you understand what could be the number in India. With this, hello and good morning. I am Dr. Bhavna Shinde, and today I'm here to take you through the autism awareness slide kit of mine. So I'm talking in details about, also it is my personal journey. I think one point has been important to me, that I'm also a mother of a child with autism. So I would like to thank SRL Diagnostic and Dr. Anup sir, not only for inviting me here to talk on this topic, which is very close to my heart, but also about my personal mission. And one more extra thank you for Dr. Anup for giving this wonderful introduction of mine. Thank you so much. So with this, I would like to start. Can you please display the slides?
Yeah, sure.
Yeah. So we might have seen many children, or my question is for you. Have you seen, there's an animation, if we can go on slide share mode. That would help.
Can you see? Shall I?
Actually, it is not, okay. So if we go by one, if we go one by one would help.
Yeah.
Thank you so much. Thank you so much. So have you seen?
Dr. Bhavna, I'm giving you the control. I'm giving you the control. You can do it from your end. Just a moment. Yeah. You can move the slides if you want.
I would request your assistance in this because I have logged in from my mobile.
No problem. No, please go ahead.
Yeah.
No problem. No problem. Please go ahead. Yeah.
Yeah. Thank you. So we might have seen individuals, children, adults in our society who particularly have some kind of social impairment and communication difficulties. Matlab kya hai? So haven't we seen a child who sits aloof when other kids are playing around and child sitting aloof, not interested in others, what others are doing? So in general, we know that typically a child is very curious, is very much interested in the surroundings. He is interested in what others are doing, what his peers are doing. He wants to join them. But there are certain children, of course, we have seen those who are not apparently interested in all this, neither in surrounding nor in people. Have we seen such? Yes, definitely. Have we seen such children or individuals where, particularly in children, so when you call their name, they may not respond to you even multiple times. What we call is as a response to name call. Have we seen a child while talking does not make an eye contact? Yes, definitely we have seen. So this comes under social impairment and communication difficulties, when we know that children, they are quite interested in their surrounding and they keep on sharing, Mama, look at this green car, or look at that girl, or look at that child doing. So children are usually curious. They want to share. They want to tell parents, tell people around them. So what is exciting around them, what they like, what they do not like. But we also know about some children, they find it difficult to share. Yes, we also know children who are, to put it into better phrase, are late speakers or find it difficult to express what they like, what they do not like, even the things of their needs. Yes, we definitely have seen such children. Next, please. And so basically, when we say awareness, what is awareness? You might find different definitions. You might find different meanings of the word awareness. But to me, when we say awareness, awareness is exactly making your mind know so that your eyes can see. Unless your mind knows it, your eyes won't be able to see it and won't be able to identify it. So today's my presentation is basically making you aware, making you know what are the alarm symptoms, what are the signs where you need to go to the pediatrician or your doctor so that you can get it worked upon. So this is important. That is why I have put it in a very simple words and in very simple language. So repetitive and characteristic behaviors, what does that mean? So have you seen a child who keeps spinning, doesn't stop? A child, when you go to the parks, gardens, so in the play area, a child playing on the swing and is not ready to get down at any cost. Have you seen a child who in the public, in a very crowded area, finds very difficult to cope up and throws a meltdown? Yes, we have seen. I'm not saying this each and every symptom of this is of autism. What I'm trying to say is just be wary of it. It can be an indicative sign or indicative symptom. So there are characteristic behaviors. So just to simplify it, we have 5 senses and +2, which is vestibular plus proprioceptive. In children with autism, this sensory system, some of them might be overwhelmed or some of them might be underwhelmed, or the multiple the probabilities coexist when it comes to sensory system. And out of that, they come across as different people when they are exposed to those stimuli. I'll give an example. My son is 7.5 years old now. So his auditory is overwhelming, oversensitive. So what others may not be able to perceive, the sounds, he perceives it. And even the sounds like the mixie in house. So even those sounds are very overwhelming for him at times, and which is a reason enough to throw him into a meltdown. So this characteristic, this is just a one example I have given here of the sensory this processing disorder, which we call it as where the sensory systems are processing the stimuli differently. So definitely we have seen all the symptoms and signs. Some of the symptoms and signs are already explained by Dr. Mondal very nicely. Next, please. This is just a pictorial representation where we have seen children being little hyperactive. They have some kind of aloofness, even the depression. See, the basic thing is, to give you a background, how do we learn to pick up the skills, life skills? How do we learn to speak, or how do we learn to communicate? How do we learn to express? Just by imitating people around us when we were small. This is how we learn. But what happens in case of autistic children, that they like to be in their own zone, in their own world. So they are not very attentive of what's happening around, and that's why there is a delay in picking up the skills. That is the reason there is delay in development. So basically, all this, when the child is not able to express, when people around them, people around him or her is not able to understand what the child is trying to communicate, so definitely there would be some kind of behavior. So okay, the word behavior here in case of autism is used for inappropriate behavior. So if I get time, maybe we can at the end of the presentation we can define and see what could be the behaviors. So definitely, if the child is not able to express what he wants, is not is being understood by people around him, so there could be a chances of depression, anxiety, and further deterioration in his condition. Next slide, please. So all the parents who are attending today's talk, they need to be wary of this fact that if these symptoms are present in your child, then you definitely need to get it worked upon. You definitely need to see a pediatrician, see a doctor. Again, one point I would like to mention here is, if you see this kind of symptoms or behavior in your child, be upfront in mentioning those to your pediatrician, because a pediatrician who is seeing 30-40 children a day may not notice that your child is different than other children. So for that, you have to be, this is my personal suggestion, you have to be upfront in explaining those, in discussing with your pediatrician. If I have to tell my personal experience, which is unfortunately is not very good. So we had a pediatrician, he had been seeing my child regularly, and he could not pick up. He could not pick up that my child was different. Even at the age of 1.5 years, 2 years, he could not pick up. So then I went to other pediatrician, and top notch. All these guys are top notch. So when I went to the other pediatrician, I tried to explain the condition. I tried to tell him, my child is not listening to me. My child is not following my instruction. Whenever I call him his name, he does not respond to it. Okay, so even the pediatrician wasn't, he must be aware. Of course, they are aware, but taking into account what parental queries are, sometimes the parental queries and concerns are dismissed just because it is considered that mothers are overconscious, hyper excited, and hyper worried for the child. So that is when this is my personal suggestion. Whenever you feel like discussing this, you feel like getting it evaluated, then please let your pediatrician know upfront. Tell them that you are observing this kind of symptoms. And overall, see, our society, we live in India, and India is such a wonderful country. Here people are so very curious about your life, and whenever you go outside, you go to gardens, park, there would be some people, there would be some kind ladies who come to you, and they keep asking the questions like, इसका थोड़ा दिमाग अलग है क्या, इसका थोड़ा ये बाकी बच्चों के साथ क्यों नहीं खेलता, and such kind of questions. Those questions might irritate you, but you should take into account that whatever changes or differentness of your child is noticeable by the others. That simply means you need to get it evaluated. Yes, so next slide, please. Okay, so how is the diagnosis made? When you go to a pediatrician, developmental pediatrician, they do a complete workup, they take a complete history right from the developmental milestones of your child, which milestone has been achieved at what age, and all the things. When you explain the symptoms, they do their workup. Sometimes necessary, they'll ask you to go for the investigations, like most of the time they go for assessing the hearing, if the child is able to hear. So this is just one of the examples. The complete workup is done. And then if the child is too young, then probable diagnosis is given. So in any case, once you see the symptoms, irrespective of the label, see, irrespective of if the child is getting the diagnosis, there are parents. So since I have been working with parents across the globe, I am talking to people in USA, in UK, in Germany, and other parts of the world. The concern is same. My child has a little bit of problem. He doesn't have much problem. Or my child's autism is better than the other child's autism. So irrespective of that, you know, these are the concerns in your child. So this can definitely be assessed and can be managed. To start with, once you get the diagnosis, or even if you don't get the diagnosis, let us understand if we have any medications. So if you consider, I really do not like to use the word cure, but since it is for a presentation is on awareness and for general population, there is no cure of autism. It is a neurodevelopmental disorder, as very well explained by Dr. Mondal. It is a neurodevelopmental disorder. That means when the child is developing, the neuronal side, the nervous system of the child does not get developed the way it is in regular conditions. So there is no cure as such. And if you're talking about medications, then to treat or cure autism, there are no medications. But are there any medications for associated conditions? Definitely, yes. Associated conditions, for an example, anxiety, depression, there are medications which will take care of the associated symptoms, coexisting conditions. So those can be taken care of medications. Next, please. Then how do we manage, or how do we care autism? Next, please. So there are therapies. Okay, so these therapies are long-term. This is probably one of the very rare conditions where the treatment is very long-term and through therapies. What are these therapies? Okay, So to start with, occupational, in India, generally occupational therapy and speech therapy is prescribed. So when you go to your pediatrician, your neurologist, or your developmental pediatrician, depending upon child's condition, if the child is verbal, that means if the child is able to speak, then probably speech therapy can take a backseat. But again, speech therapy is not strictly not only limited to if the child speaks or not. It also includes communication, expression. So your doctor will take care of the prescription of the therapies. So there is occupational therapy, which is mainstay in India. So in occupational therapies, so they basically work upon the retaining and developing the meaningful activities in children and the adults. So we have been on occupational therapy. My child is now 7.5 years old, and last 5.5 years we have been occupational therapy. And again, we means my child. So as parents do not have to go for this therapy, I mean undergo the therapy, but we they are always advised to be in the therapy session so that they understand what is happening inside, and those activities they can implement at their respective places. Then there is speech therapy. Again, these are prescribed by the doctors. So speech therapy is where, just as I mentioned, so they work on speech as well as communication. There is ABA therapy, behavioral therapy. So in USA, AB is the mainstay of therapy. In India, somehow the ABA is not given the kind of due. So ABA therapy is also there. There are various other therapies like SIT and all. So depending upon your child's condition. Again, so autism, as the name is suggestive, it is autism spectrum disorder. So it is a full spectrum. So in the spectrum, if I have to explain it in a better way, so in the spectrum, there could be some children individuals lying on this end of the spectrum. So give you an example, Elon Musk, who very recently has admitted that he is an Asperger guy, that is Asperger's syndrome. So although this is an old nomenclature, but I think it makes it easy to make you understand the Asperger's syndrome, which was previously called as high functioning autism. So where the person may not require that much of support in day-to-day life. But if you come to this end of the spectrum, then our children may require a lot of support in daily life. So it's a spectrum depending upon where your child lies. On this spectrum, the therapies are prescribed. Next, please. This point I have kept it as very important as other modalities. Next, please. So in other modalities, I would not name the modalities which are being practiced, which are considered unethical, which are not approved by the regulatory authorities in India or in the world, but you would come to know about as a hearsay mode of communication that the particular modality will get you cured of autism. Then if you come across such communication, then the first thing I would request is that please contact your doctor. Do not go for any random kind of modality, any random kind of YouTube or Dr. Google methods. So wherein they keep on prescribing some things. There are parents, not only in India, but otherwise too, in so-called the Western and the very progressed part of the world, they are following certain modalities. But please first contact your doctor, discuss those with your doctor, and then go ahead or do not go ahead. Next, please. A very important thing. So it so happens that, as I told you, your child likes to be in his personal zone, in his own world, and he finds it difficult to observe the things around him. So next, please, as a parent, as a caregiver, it becomes your responsibility. I always say that the parents, the caregivers are the bridge between these two worlds, your child's world and the real world, what you are facing, or what the child has to face ultimately. So parents are the important bridge. And if the parents are not educated on their role, how to take care of your child, autistic child, then things would be difficult. Once you get educated as a parent, once you know how to better understand your child, how to not blame your child, how to not call him names like stubborn hai, sunta nahi hai. So once you understand how to bring your child out of his zone and how to make him observe the things around him, and how to make him communicate, how to make him express, how to make him acquire skills, how to make him acquire ADL, daily routine life skills. So role of caregivers is of utmost importance. So there are various caregivers programs. So I suggest please go and attend those programs wherein through which you would understand how to understand your child better. Next, please. So finally, with this note, I would like to end my presentation that be the parent your child needs and not the parent you always wanted to be. Your child needs a different parent, different version of yours, not different parent, different version of yours. You are more than enough. You are the world for your child. So a different version would make him prosper. Next, please. So as I mentioned at the beginning, so I am on the mission of enabling 1 million caregivers across the world into leading empowered life. So I have certain programs, and if you have any queries, so please contact me on LinkedIn, Facebook, Instagram. YouTube is upcoming, wherein you are going to find some exciting content. Thank you so much. With this, I would again like to thank SRL Diagnostic and Dr. Anup for giving me this wonderful opportunity. Thank you so much.
Thank you, Dr. Bhavna. I think I've seen a total different version of you today, as I've known you almost for, I think, 2 decades or so. It was a wonderful talk, and really, I think for common people to take an effort to simplify such a difficult topic having varied aspects and simplify it for a layman, it is like it takes quite a lot of effort and skills, and I think you have done a wonderful job in your talk today. And definitely, yes, the important, I'll say, the fulcrum or the leverage in the management of children with autism or autism spectrum disorder is the earliest in the developmental graph, the things are picked up, the earlier the therapy is instituted, the outcome definitely is much more better. Studies have shown that is what is important. So with this message, I think I'll take it to the audience. Any questions? I think Dr. Mandal sir, Dr. Bhavna, they're there to answer any questions. We'll take up the questions now.
So you can raise hand and I'll give you the option to unmute anyone. I definitely have a question, but I'll put my question at the last.
Yeah, I think, Dr. Bhavna, please go ahead with your question.
My question is for Dr. Mandal. When should a parent think of going for genetic assessment? How would it help benefit? How would it benefit the family?
I think once a parent meets a pediatrician, definitely a parent should want to know what their child has. Only having a diagnosis of autism is not fair enough for the parent as well, that the child has autism. Genetic diagnosis should be sought for by a parent as soon as they have known that their child has certain problem, whether it is autism or autism, along with some amount of cognitive impairment. Genetic diagnosis should be sought at that time. See, it depends upon in which society people are living. In US, if a child is stamped with autism, he or she gets a lot of government support. It's not so in our country.
Yes.
But the parent needs support from the school as well. So if it's autism and the child also has Prader-Willi syndrome, the school should know that there is something to do with his food. Right? So if it is autism and the child has some other disorders which predisposes a child to seizure or epilepsy, which the child does not have now, the school should know. So probably it's the first go when the parent knows that the child has certain problems, they should seek a genetic diagnosis. Knowing very fact, and the person who is helping that parent out in that situation, the clinical geneticist will also tell what are the yields of tests. He or she should be well equipped with all queries from the parent.
Thank you. Thank you, sir.
Thank you, sir. I think I'll like to add one point from my side, just to add on what Kaushik sir has said. When it comes to genetic evaluation, I think for children with autism, families should make at least one consultation with a clinical or a medical geneticist. That is important because it is when you explore the family history, whether consanguinity is there, you look for clues like, see, what happens is, for many genetic disorders, autism spectrum like features are one of the component of the varied clinical presentation. And if you're talking purely of child with, say, autism or autism spectrum disorder who has been diagnosed, for them, a chunk of them are the cause is genetic. So it is both ways. And wherein, if it is genetic, then we are looking at a molecular testing, specifically what disorder it is and what test should be done, because depending upon what genetic diagnosis is made, the test that a medical geneticist is going to advise is going to differ. Right. So if it is Fragile X, we think of a different test. If it is a Rett, I'm thinking of a different test. And if it is a general presentation with autism, no other specific of a microarray. So I think for every child or family, and particularly in those where recurrence has happened or there is a member in the family who has similar symptoms, more so in such cases, I think a medical genetic reference should be advised. Yes, Dr. Bhavna, you wanted to add something.
No, thank you so much. It helps.
Yeah, any more questions? Yes.
Yeah, Dr. Nasreen, you can go ahead.
Yes, thank you for the wonderful information in this conference. I have a doubt, like how is the prevalence of autism in the rural and urban women? Because in rural areas, the women are not much educated, and their lifestyle will be different. In case of urban mothers are different, they will be more educated. So, is autism related to any of this? Is it also occurring in this type of underprivileged women? That's a question I want to ask.
Yeah, Dr. Bhavna, would you like to answer?
Yes. So, Dr. Nasreen, that's a very good question. So, to give you the prevalence, the exact prevalence in India is not known. Exact prevalence. So, but the IAP says that it is as same as USA, and USA they had mentioned it's 1 in 100. That's 1%. So there are different versions as well for USA, but the document, India's documents say that it is 1 in 100. But to give you, to tell you in real that we do not have the concrete data from India to talk about prevalence. So, but as you mentioned that in India, in rural and in urban, then it is difficult to say if the prevalence is different or the same.
Okay, yeah. Thanks, ma'am.
Just Nasreen, ma'am, just to add on, the health seeking behavior, it definitely differs in the rural and the urban population. That probably would make a bit of a difference once we are looking at prevalence, because in urban population, the tendency to seek medical advice is more in such a situation. And another aspect in rural areas is accessibility or availability of a specialist. Even that makes a difference. So I think prevalence more or less is same everywhere, but these are certain factors which might be skewing the effect, and there might be some discrepancy in the figures, like impression maybe there it's more prevalent in urban or rural, but it is more or less the same across.
Sir, sorry to interrupt. I went to another conference a few years back on autism. There I got this information that women who are happy during their during their pregnancy time, they seem to have no autism babies, and something which is bothering them during their pregnancy, whether it is their in-laws or issues or finance or whatever, are giving them some stress condition. So those kind of mothers give rise to autistic children. And I also want to know this clarification also. If you know anything about this, ma'am.
You never know about these things because there are no RCTs on this. So
Okay.
whether randomized control trials. So whether it's because, okay, I can tell you about some interesting how mothers are blamed. So there was some time back in 1940s around, there was a term called as refrigerator mother therapy. So since you talked about pregnancy period, I'm just taking it forward to the early childhood period. So there they blamed mothers for somehow creating autism or making the child autistic because they were cold towards the child.
Oh.
So these are some theories, and those were dismissed and bashed very heavily around. So, but what you said, see, there are certain factors, as even Dr. Mondal has mentioned. So there can be a teratogenicity, also some factors related to pregnancy as well. He mentioned about rubella and other things. So
Yes.
can stress be a factor? You may not know. So again, whatever factors are there which are being suspected or under the scrutiny, those again do not have the concrete data to make a firm statement on it.
Thank you. Thank
Yeah.
you.
Thank you, Dr. Bhavna. I think we have one more question. Anurita, ma'am. Am I audible?
Good afternoon, everyone. Thank you, Dr. Kaushik sir. And can you hear me?
Yeah. We can hear you. Yeah.
So thank you for the insight that was given into this autism spectrum disorder. So a lot has been known about autism being associated with intellectual disability. But what about the children who are highly gifted intellectually? And they may have some behavioral issues. So in these situations, how are they different? Severity wise, genetic wise, or treatment? How would the management be for these different perspectives?
Yes, Dr. Bhavna, would you like to comment on this?
Yes. Again, this is a very nice question, ma'am, because we usually come across such comparisons. So as I mentioned, it's a spectrum. It's a complete spectrum. So child can be here at this end or at this end. So as I given the example of Elon Musk, the #1 billionaire or the richest man or among the top 5 richest guys in the world. So he is also on the spectrum. And there is again speculation on Bill Gates was or is on the spectrum. Again, there are different theories about Einstein's being on the spectrum. So these are the speculation about the Einstein because the person is not alive now. So you cannot make the diagnosis as such. But as I mentioned, some children may require a great deal of help in their daily life, but some individuals may not require. So it is again said that since these individuals have singular focus, so they might excel in certain field of life, but it is not true with all the children. So it depends if the person lies in towards this part of the spectrum where he needs a lot of help, and again, as Dr. Mondal explained, that the intellectual disability also plays an important role, then to expect and assume that every person with autism has some or other excellent attributes. So that may not be the right way of looking at it.
Okay, thank you, Dr. Yeah, I have one question for Mandal sir. So in his vast experience till now, he has seen a variety of genetic cases, disorders, autism spectrum being one of it. So just like we are talking about the prevalence in general population here, but I want to understand like what has his experience been, like patients walking in the OPD or the number of genetic cases that he has seen, and what proportion of those patients had like autism or autistic features. What was his experience? So please could you just elaborate, sir?
Just to have a trail on the two other questions. Dr. Bhavna, is it true that highly functioning parents have children with autism? The prevalence in highly functioning, intellectually functioning parents have more prevalence of children with autism? Probably that is one proven fact, and all other are dismissed because you know in-laws are being attributed to all mishaps in a couple. But apart from that, probably very highly intellectual parents have slightly more children with autism. Maybe because they don't can give so much time, or it is something related to the genetics.
Sir, I would like to disagree on this. If the parent is not being able to spare the time, or if he chooses not to spare that much of time with the child, that shouldn't be the reason for child being autistic. There could be some mental or psychological expression of this kind of surrounding, but autism is not.
But I think it is somewhat proven that parents who are intellectually very high on the high spectrum, they have slightly more prevalence of a child born with autism.
As I just had talked about refrigerator mother therapy, wherein they said that the parent is not.
No. It is not that the parent is not giving time, but the child born to parents who are intellectually very high, probably maybe somewhat related to genetics, that there are certain things that those parents are also in some form of spectrum. They are very intellectually or very on high demand. They are very limited focus in life. Maybe the prevalence in such parents with children of autism is slightly high. Probably this is one.
Yeah, this like for this point, I think we need to dig out more literature and see more studies. But definitely, like from what names have come up, Bill Gates, Elon Musk. So I think what sir is saying, but this is like just a names which have come up. We don't know most of the other aspects of it. So definitely, I think much studies are needed on this.
Yes.
And to answer your question, Dr. Anup, we see a lot of children with dysmorphism, and Rett syndrome is probably a very clear-cut diagnosis, not so for Fragile X. So when we, and as we have already discussed that children with intellectual disability, many of them are having autism, which can be picked up. So if the child is very severely disabled or have a very high degree of intellectual disability or global developmental delay, we really do not know. But there are certain disorders like MPS type 3, right? So these children have a very high degree of ADHD, and probably also they fall in the spectrum, autism spectrum disorder. But we generally do not separate autism spectrum disorder separately. Just for autism, very small number of children will come to us. More children will come to us because of their developmental delay, and it's global most of the time. Many of them are syndromic, which we pick up. Many of them are non-syndromic, or we do not know. Then we start investigation stepwise. But with only autism, only very small number of children come to our
Yeah, thank you. Thank you for the information, sir. I think Mr. Farsad had some question in the beginning, which is saved for. So, Mr. Farsad, can we have your question, please?
Yeah, so my question is that I have a kid in my family, my relative's kid, and 3.5 years old, looks fine, spend a lot of time on playing games on mobile and watching YouTube videos and all, but has not started speaking. And I'm afraid that if I talk about this, that like this should also be kept in consideration. How would the mother take it? So are there scenarios where people are in self-denial mode, that this is not like that and it will take some time? Many kids start speaking little late. So I'm really worried. So if I'm sure if things are addressed in the early phase, can be corrected, or there would be some success for sure. So how do I tackle this case? And I seriously want to help them.
Yes, thank you. Wonderful question. Quite common scenario we come across. So I'll request Dr. Bhavna, would you like to comment on this, please?
Yes, since you talked about denial, there is a progression. To accept any diagnosis, there is a progression. You go through the denial, then there is a resolution, then there is a resolution, then comes acceptance, etc. So there is a complete spectrum of acceptance. So talking about denial, most of the parents, including myself, so they go into denial. So it is, see, the first and foremost, I always say the people are not ready for parenthood itself. So we go into producing children because it's a norm in the society. But we want to be a parent. We want to have a family. But when the child is a special child, so we are not taught about the parenting. But when a child is born who is a special child, you are not ready for the special parenthood, the special parenting, which you need to cater, you need to offer to the child. So this is a very natural and obvious reaction. To tell you about my personal story, my husband he remained in denial for almost 3 years, even after the diagnosis. My child was 2 when he was diagnosed. So it took him a lot of time to understand that his child is different. Although he had a lot of dreams, aspirations for the child, that child, my child is going to do this, my child is going to do that. But when the child is different, so that's what I always say, that be the parent your child needs. So denial is a very natural reaction, is a very natural response. And coming to the question which you asked, how to deal with the situation what you are in. So since it's a very sensitive matter, being upfront and talking to the parent, saying that the child is different or having some problem. Other than that, I would advise that directly go to the expert. Let the expert do the job. You might have to convince the parent that let us get it evaluated, or in whatever thing, but this is the job of an expert. They have system in place, they have counselors in place, they have therapists in place, so they would take care of the part where the diagnosis is communicated to the parent, if
Thank you
at all
so much.
there is some diagnosis.
Thanks a lot.
Just to second Dr. Bhavna's word, it's the expert job to do it. And probably you first will take to a pediatrician, and never forget that it can be just hearing impairment. So the child is not speaking, the child is interacting well, it can be just hearing impairment which can be corrected. So don't think that only the child has autism, right? Or autism spectrum disorder. So there can be various other situations as well, where a child grows, sees, interacts, but he doesn't speak.
Right. Thank you so much, Dr. Mandal and Dr. Bhavna. Thanks a lot.
Yeah, so thank you, sir, and Dr. Bhavna for the reply. And the bottom line is to, in such situation, to get the child evaluated from expert, because the concern why the child is behaving differently or not interacting. There could be various reasons, as Mandal sir mentioned. So do we have any more questions?
I think Dr. Sunandi has a question.
Yes, ma'am.
Actually, I am not doctor. Morning, Hemant Thigne invited me. So I will introduce myself. Myself, Swanandi Rath, running an NGO, Jagruti Foundation, which is about women empowerment and menstruation hygiene management for specially abled. So till now, I covered 2,000 adolescent girls in and around Pune, Usmanabad, and Gujarat. Apart from that, my own sister-in-law running a school for specially abled, and my bhabhi in mother's place, bhabhi also running a daycare for specially abled. So I thought that I will host one more separate seminar, because today everyone is busy in Gudi Padwa. So just I thought medically I couldn't miss link with you, but I am into this menstruation hygiene management for specially able. Apart from that, autistic, CP, polio I am covering, and continue. I am committed for this cause till my last breath. That all I want to share. And awesome session today. Thank you.
Thank you, ma'am. Thank you. And I really appreciate the noble work that you're doing. So I'm definitely for such cohort of children with autism or autism spectrum as they grow up, particularly for girls, menstrual hygiene again is an issue that needs to be addressed in a proper way. Yes, and it is really very important. So definitely, I think Dr. Bhavna is there. You are here. So these things we can take it up further, and definitely, as you requested, I would love to maybe host one more session like this on a different topic that you suggested.
Yes.
Let's get in touch and see how we can do it. Yes.
Yes, and in that, yes, sorry, in that we will empower caretaker to deal with it effectively, because they don't have any idea. I know where miss it is sensitive topic.
Yes.
Yes.
Even वो जो sanitary napkins का cover भी change हो गया ना, so they will get hyper. That much of sensitive. So we will special. I invite you all to organize one special related to this topic. Already they are autistic and evaluated. Now what next like that?
Thank you, ma'am. We are actually humbled by your invitation to work on such an issue. We'd definitely love to associate and take it further. Yes, thanks for your inputs, and I should congratulate and compliment you on the behalf of SRL family for doing such a noble job, and definitely we'll support you in whatever way we can.
Yes.
Thank you, ma'am. So do we have any more questions?
No, I don't think so.
Yes. So with this, I think we have come to end of today's event. I want to thank Dr. Abha for convening this session, the SRL team, SRL family, Mr. Faraz Khan, who has been organizing it, taking the technical care of the technical aspect today. Most importantly, I want to thank Dr. Kaushik sir, my teacher, my mentor, who has accepted my invitation, and he cut short his bike excursion today just for this event and simplifying such a difficult topic for lay people. Again, I thank Dr. Bhavna for taking out time from a busy schedule and joining us for this event. And definitely, with permission from both the speakers, we'll be hosting this video on our website for awareness of general public. I think it will answer a lot of questions for general public. The discussions that happened are very important. So that is what is needed. So definitely with this, I think we'll end today's session, and looking forward to many more such informative academic interactions and addressing issues which are of relevance for all of us today. Yeah, thank you. Thanks for joining. With this, I think we'll end today.
Take seconds.
Thank you.
To acknowledge this, tomorrow I am receiving award on state level category for this category only, social work and Ragini Foundation. And today digital magazine is launched, the Chaitra Palvi. So what is better than we are celebrating Padwa with such a noble think tanks. Thank you. I am privileged and honored. Thank you, sir.
Congratulations.
Thank you. Thank you. Yes.
And that's a big achievement. big achievement. Congratulations.
Thank you, sir. Thank you.
So we'll get in touch, ma'am. Yeah.
Yes. Okay. I have Bhavna ma'am's number.
Yes.
Acha, okay.
Thank you.
I didn't know this.
We'll
Okay.
coordinate.
So
Sure.
happy Gudi Padwa to everyone.
Yes.
Yeah.
Yes.
Thank
Bye-bye.
you, Team
I'm
SRL.
humbled.
Thank you, Team SRL, for having me
ma'am.
here.
Yeah,
Thank you so much, and happy Gudi Padwa and happy New Year.
yes,
It's
Yes,
big
bye.
pleasure.
Yes.
Happy
Yes.
yes. Supriya madam also for organizing and taking the concept to materialize it today. Thank you, ma'am. And thank you everyone
Thank you.
who was
Thank you, sir.
towards this event. Yeah, with this I think we'll end. Yeah, good day.
Thanks a
Good
lot.
day.
Wish you all a great day
Good day.
and a happy Sanatan New Year to everybody.
Yes. Thank you. Thank you.